Welcome to the Western Wisconsin Journal. I'm Kendra Grams, the pastor at First Presbyterian Church in Hudson, Wisconsin, and today I am honored to host a conversation about St. Croix County's upcoming Mental Health Symposium. And so I'm here today with St. Croix County's Director of Health and Human Services, Bob Rohret, and Deputy Director Shar Lopez. So let's start with introductions. Bob, you first, and then Shar. Can you tell us a little bit more about yourself and your role at the county?
Sure. So my family and I moved to the Hammond area about 9 years ago. Been with St. Croix County about 3 years now as the Director of Health and Human Services. Started just in time for the pandemic, so that was a lot of fun. Yeah, so we enjoy this area, and this is where we want to live. Previous work experience has been in other county government positions in Hennepin County and Ramsey County in Minnesota, and then various nonprofits in other states.
Great. And Shar, a little bit about you.
Yeah, I'm Shar Lopez. I am the Behavioral Health Administrator and the Deputy Director at St. Croix County. My areas that I work closely with are we have an integrated clinic which has both mental health and substance use treatment, everything crisis related, and anything relating to adult protection or access to services within the county. So we have a very busy area that we work in. I came to the county just after Bob, so right smack dab in the middle of the pandemic, which was interesting. We have, I have a variety, a buffet of experience. I came from, actually directly from prison. So I worked in the Department of Corrections prior to coming here, but also worked in higher education, in public schools, doing mental health in the schools, did some day treatment. So just a variety of experience to bring to St. Croix County.
Great, and I'm sure you stay very busy with that breadth of experience for both of you. So moving to our topic today, I know this is the second, hopefully annual, Mental Health Symposium, and last year the symposium focused on suicide prevention, and I understand this year the focus will be more towards substance use and its intersections with addiction. So Bob, could you share more about how you came to that particular topic and wanted to organize this year's symposium around it?
Sure. So as you said, last year was our first annual Mental Health Symposium, and our idea was to take a variety of topics that relate to mental health and focus on those each year going forward. It doesn't mean that the information that we presented last year in the symposium just was a one and done kind of thing. Obviously, we're still focused on suicide deaths or deaths by suicide in St. Croix County. But this year we decided to focus on addiction specifically, and that is because what we see as a county is addiction impacting various areas of healthcare, public safety, really all aspects of life for a lot of St. Croix County residents. And this is an important topic to focus on because I don't think a lot of people really understand what addiction is or how to respond to it, how to care for it, people who have it. So that was our reason for selecting this topic.
Great, and within that broad topic, are there particular aspects that the symposium aims to address, knowing it's a big topic?
Yeah, it is a big topic, and it's a complicated disease. What we hope to address, I think, in this symposium is to, for one thing, help people see addiction through a different lens, through the lens of healthcare. I think too often we have separate healthcare systems for behavioral health and for the rest of healthcare. And what we hope to, in part at least, what we hope to accomplish with this symposium is to help people understand that addiction is a chronic and progressive disease that can affect anyone, and that there are treatment or care options available to people. But if we can bring together folks from a variety of backgrounds, parents, the general public, policymakers, etc., we have an opportunity to sort of have a common understanding of what addiction is and what we can do about it as a county.
Sounds like some great goals. So in that, it sounds like you mentioned them, but what is your intended audience? Who do you hope will come, and what do you hope they gain or take away from the symposium?
Sure. So the first thing we want to do is sort of introduce the topic to people so that we have a baseline of understanding for what addiction is. And from there, really the topics or the presentations that we hope to provide would focus on a variety of populations. So we would look at what is addiction. The audience themselves would consist of, the audience we hope will consist of parents, students, other healthcare professionals, really, like I said, anyone from the public, policymakers, et cetera. And our intention is to sort of move the needle a little bit in their understanding of it and how it relates as a healthcare condition, not as a condition that's oftentimes viewed as a personal choice to do things against your best interest.
Yeah, so that kind of dovetails into this being under the wider umbrella of mental health, yeah. Right? Is there a specific aspect of the connection between addiction and mental health that you Sure. would highlight as we seek to have a new lens, as you say? Sure.
So looking under the broad umbrella of health, mental health is obviously a component of health. Often, I think you have this misunderstanding that addiction and mental health are separate kinds of issues, that you have to treat one before you treat the other, or you treat them independent of other health care. Our hope is that we bridge that gap between addiction, mental health, and other forms of health care so that people see it as a part of a whole system of care, or a condition that's part of a whole healthcare system. I don't know if I'm explaining that well, but the intention, again, is to show that addiction and mental health that co-occur, those conditions co-occur oftentimes, are a part of the overall health of a person. And how can you treat those conditions independent of physical health care? You really can't. So again, they're all connected. Health is all connected. This is part of that. Yeah, that holistic approach that takes the whole community as right. well. So great. Well, Shar, moving over to you, maybe make this a little more local for us. What are some of the impacts that you all have been seeing of substance use and addiction, and what does that look like in our county locally?
So I think Bob touched on it a little bit, because it isn't just an interpersonal thing. It really has an impact on many systems. So we have our hospital systems and our legal systems and our jails, and our every day are impacted by substance use and mental health. Kind of narrowing down more to getting a little more into the weeds to the county, we have a lot of different services that, I mean, in the world I work in, it's really everything that I do. It revolves around that. So we have all sorts of programming that is available. We have funding sources that are specific to different things. So really the impact really drives a lot of the services that we provide within the county to assist folks in getting the services that they need, and just helping to get them on their own recovery journeys.
It sounds like the county's looking to be a partner with people in lots of different ways, and the symposium is part of getting that message out.
And really partnering with a lot of those systems that I mentioned, and making sure that we're working as a continuum and not in silos.
Great. So from a health and human services perspective then, maybe can you give me some of examples, just highlights, teasers ahead of the symposium, if you will, of how the county then is seeking to be that partner in addressing substance use and its effect on whole person health? What's maybe one example of something you're trying to do?
So and actually we have some, one of the things that COVID brought us was some funding to address this issue. So we have been able to partner with, in particular, we're partnering with the jail in providing medicated assisted treatment programming within the jail for those who are releasing and coming into the community. So doing a much better job of providing those transitional services to those that might be our most vulnerable population.
Great. Yeah, would you have anything to add? Any other highlights, teasers of things
Sure.
the county's doing?
Well, I think just to add to what Shar said too, the interface of public health and public safety is really important to focus on when it comes to addiction. It crosses those boundaries between public health and public safety. And that's part of the reason, as Shar said, that we're focusing on people who oftentimes interact with law enforcement or end up in the court system as a result of a nonviolent, maybe substance use charge. And we're trying to think of ways in which we can deflect or divert those folks to treatment options or support options instead of having them cycle through jails and emergency departments and not get the help that they need. The way I think that we are approaching this from a holistic healthcare approach is to work with our hospital partners on designing and implementing programs that attend to addiction more thoroughly, if I can use that, or do more in-depth assessments in the hospital setting when people present with acute withdrawal or intoxication. An example would be of the difference in the healthcare systems between behavioral health and physical health care is, if you think about it, if you have chest pains and you go to an emergency department, you get one kind of response. There's a team of professionals that see you very quickly, medical doctors attend to you very quickly, and you have tests run, etc. Whereas if you imagine someone going to an emergency department who's intoxicated and or in withdrawal, they might get a very different response from the medical system. That's not to diminish what our hospital partners do. It's just a reality of how people view this illness differently than they would, say, heart disease, and respond therefore differently.
Yeah, it's great to hear the collaboration and work toward bringing people together. What would you say to community members who might want to get more involved in this topic and supporting those affected by substance use and addiction in various ways? What would some tips be or starting places? Maybe we'll go to you.
So one thing I think is incredibly important is those who have gone through their own recovery and have that lived experience can be some of the absolute best resources that we have available. So anyone who has that recovery journey and would like to share that, to really look to see, look into being a recovery coach or into a certified peer specialist, because oftentimes that's more effective than sitting in a therapist's office or sitting in a counseling group. And we don't have enough. We know that we have a lot of people who have gone through that. We just don't have those resources currently. And then the other thing I think is just really being that ear to listen to those who are really struggling and helping them make that phone call and helping them reach out to the resources. And because oftentimes that first call is absolutely the hardest, and just helping them ease that into their journey.
What I love about both of those examples is that emphasis on our shared humanity and the power of being people with one another, because we all have different struggles, but if we can bring that shared humanity, we can hopefully help everybody move toward health and wholeness.
Yeah, the relationship that people have is oftentimes the predictor of the success of somebody coming through that journey. Yeah.
Great to know. So maybe Bob, if people want to know more about the symposium, get more details, I know it's May 17th, but where would be the best place to look up and get all the information ahead of the symposium?
Sure. So the symposium is May 17th, as you said, at Northwoods Technical College from 5:30 to 7:30 p.m. And if you would go to our county website at www.sccwi.gov, there is information there, more about the website and additional resources that people can explore.
Great. And maybe to both of you, what would be the takeaway message to everyone in our community, in the county? What would you have them know is the key, or a key, maybe a key important thing to remember when looking at this broad topic of substance use and addiction?
I think for me, I think it's simply mental health is health, and that it really gets overlooked, and it is that simple.
And I hope that if people come to this symposium, that it's a starting point for having these kinds of open discussions in our communities about this, and not just addiction, but mental health, as Shar said, as a health condition. I think the ongoing efforts around this are going to be around public health messaging to communities. So this won't, like I said, this won't be a one and done kind of effort. It's a starting point to start having these open discussions. And we can continue with public health messaging around addiction, around other mental health topics that help people better understand them, feel less ashamed about admitting or talking about their struggles that they might be having. And once we do that, I think communities really are the key to having any sort of significant success in addressing this topic. Communities have to come together. They have to be the sort of foundation for anything that we do as direct care workers. But our hope is that this is a beginning point to have these open and frank discussions about a disease that people are sometimes afraid to talk about.
Yeah, well, thank you for opening up the space, for all that you both do for your teams at the county. I know you're working exceptionally hard all the time. I'm always impressed when I get to interface with the staff. So I thank you. I thank you for pulling together another symposium. I think it'll be a great opportunity. As we wrap up, I also want to thank the River Channel for hosting our conversations as always, and all of you as our viewers for listening. Of course, we hope you'll plan to attend the symposium and do your part about helping to learn more about substance use and addiction and how we can support one another toward health and wholeness. So as we bid you farewell, of course, then our hope is that you all would know peace, hope, and wholeness in your lives and whole person health. So may that peace and health be with you.